Hello, my name is Madison Murphy Barney. I am the founder and principal of the Center for Story and Strategy, the home of the Entangled Health Movement. And today's episode of Entangled Health podcast is our first episode, and I'm so excited to have you here. And the purpose of this time together is to talk about the framework that sits at the heart of our work at the Center for Story and Strategy. And this framework has helped health and justice organizations rebuild trust, reconnect to staff purpose, and move resources through the power of story and the marriage between story and strategy. And so, first, I wanted to kick us off with a little bit of a public health pulse. I recently read that as many of us know, over 25 million people were disenrolled from Medicaid during the 2023 to 2024 unwinding process. And what really struck me about that is that nearly 70% of the folks losing coverage were for procedural reasons like incomplete paperwork rather than a true ineligibility. In Texas alone, officials stripped Medicaid coverage from more than 2 million people, and most of them were children. And 1.4 million of them lost coverage for reasons like failing to return a form, and not because they weren't actually eligible. So the program, um, this unwinding process was designed to efficiently verify eligibility, but the rushed implementation of it created this exactly the opposite effect, and eligible families lost essential healthcare access. And, we've found many times, and we learn this all the time in public health, how much the things we build, like how once they are torn down or broken or rolled back in some way, it's so much harder to build back. And I think we're really in a time where we're trying to figure out how do we build systems that can sustain these things and that are organized and structured in a way where they are centered on our communities and their needs. And so that like when things like this happen, folks have the resources and expertise they need to take care of themselves and their families and not lose essential coverage. And by no means is this me saying that any individual is at fault for having lost coverage. It is certainly a systems issue, but when systems and programs are designed for efficiency, but they don't talk to and connect with their the folks they're meant to serve, the communities they're designed to work on behalf of, this is the type of disaster that happens. This is just on the largest scale we've seen in a long time. And so, this is why I will go on and on and on forever about when we are in positions in health and justice organizations to serve communities, our job is to listen to them because and storytelling is so key to that. And storytelling can inform and become our strategy when we understand that, like, that is the only way to build strategy that is protected and insulated from this type of great unwinding. Because when we build from the community wisdom and community experiences, we one have buy-in and two know that we've built something that our community understands and has the resources to navigate on their own, so it can't be so easily taken away. And so today's conversation is going to be um, the entangled health framework, as I call it, the real core of the work we do at the Center for Story and Strategy, has like a four segment process that's really core to what we do. And the first segment is of the signature framework is to listen to complexity. So often we are like sold this lie and trained on this lie. If anyone listening has a master's of public health, you know you took so many classes where it was like, siloing off health and making health an A, B, C, D thing, or a different parts of the body as different health. Anyone who has insurance knows that like they take different parts of your body and insure them differently, your teeth, your eyes, the rest of your health care. And as we know, all of these silos are completely made up and they have no grounding in our real health. Like if you have a toothache, that could lead to a headache and jaw pain and all of these things. Like that's not separate from your body. Your teeth are not outside of your body. And similarly, when we're like, oh, okay, so it's just, somebody's mental health is really impacted. Well, their mental health is really impacted because like of, perhaps their environment or their social health or their physical health. Perhaps somebody had an operation or sustained an injury and then it really took them out of the life they are used to living. And then suddenly it's like, okay, well, now, their mental health goes, deteriorates as a result. And so it's just so, I think like we suspend so much belief when we silo out health and we do this all the time, like we're trained to do it. But when we suspend belief to make these silos and then build programs around these silos, we make programs that are built on a suspension of belief and like that gets us nowhere and it doesn't ground us in the real work we're meant to do or the reality of the lived experience of the folks who are the public, who our health and justice initiatives are meant to serve. And so that's where I think this listen to complexity part is so, so key because we can't design for what we refuse to hear. And we can't design programs if we refuse to hear and like understand and accommodate the nuance that the communities that we are responsible for serving experience. And we can't if we don't listen to the complexity of the lives of the people that we work on behalf of, then we like can't actually serve them. And we're again in this land of make believe, and it doesn't serve us, it doesn't serve them, it doesn't serve anybody, and it burns through huge piles of money and goodwill and policy making goodwill and grant reports that like don't show what we wanted them to show, all because we just refuse to like let complexity be true and decide to like have it be a second thought when really like listening to complexity and letting it be true is what can make really great programming when we account for all of it. And that's why lived experience isn't like a soft data, it's strategic intelligence. So the lived experience of our communities are what like can really ground our work and allow our work to like one, get people to show up. Like people come to programming that they trust and they trust it when they have had a hand in designing it and when it reflects their lived reality. And so like it's only going to reflect their lived reality when we haven't just like sort of pulled it out of thin air or this suspended reality or our assumptions about what might be needed or wanted. And so we can't strategize and we can't make informed decisions on behalf of folks unless we understand their lived experience and have listened deeply to their lived experience and have built the trust necessary for them to share that experience with us. And so, um, like often when we have low, um, like attendance or engagement in our initiatives, or like so often I work with clients and they're like, well, these folks aren't coming to this program we designed and this, that, and the other thing. Um, I'm always guided back to questions about like the trust that they have. Because when we listen to lived experiences, trust gaps are revealed, and then we can understand how to design to rebuild that trust rather than to just like pretend that even without trust, if we build, people will still come. Because like that's just such a, I don't know, I almost think of it as like an insulting way to think of like the communities we serve are the experts in their lives and what they need to be well. They're incredibly wise. And so if we are just like bypassing them and breaking their trust over and over, we are never going to have the trust necessary to have impactful programming. So again, it's like without trust and without trust built by stories, we will never have like effective programming and we'll just constantly be like missing goals and markers, and none of our goals and markers should be defined without being co-defined by the communities we work alongside. And so, when we hear people's stories, we hear that trust gaps become really clear, and then we know where to focus trust, where to strengthen trust, where to focus effort on that, who to call in for that process. Um, and so it sounds sort of simple, but it's the thing that I see my clients skip all of the time, um, or to do sort of half-heartedly as a checked box. And it's like nothing, not like, like there's the metaphor of like you have to build a house on a solid foundation. Like we can't, like it's not everything that comes after that is going to sink because if you like build these things without trust, like you're not going to have the impact, you're not going to meet the goals. It just isn't possible if you don't have like a solid foundation with your community. And um so often like a part of this and listening to the complexity is like what we think is the problem isn't the problem. Like the problem isn't that nobody is coming to the like support group you've created or the drop-in clinic for new parents. It is nobody is coming because they like this isn't the lack of attendance is a lack of trust. Lack of attendance is a lack of like this program was designed at like times that don't work for people or with resources that aren't actually what the community needs when maybe they need a drop in for a different type of resource. And so um, the face value problem is never actually the problem. There's always a deeper problem. And often it comes to trust, and trust problems come down to years and years of having not operated with your community at the core of what you do and informing what you do, and or using storytelling just as like a nice to have or trust building as like a checked box. And so I um have worked on many programs that like had this problem, but one of them was there was one of my clients was designing um like they wanted to design equitable healthcare initiatives, and nobody was coming to their like round tables about it. And then when I had some story circles with the folks who they most wanted to engage, and understood their demands and what would they need to be there, and what was necessary to like sit at that table all together, it was like solved within a couple of months, but it's because I actually listened to the people rather than building something and being like, why has nobody come? Because it's like honestly like a little bit entitled to be like, oh, I built this thing, people should come. And it's like, I don't know, there's events going on all over the place all the time that none of us go to. And it's like, because they don't feel relevant to us or they don't feel for us. Cute. Um, we go to things that feel like by and for us and like where our people will be. And so we can't just like create programs and then face value be like, well, I tried, but no one came. It's like, well, you didn't try in a way that would allow anybody to come. Or you didn't like if you apply for funding for like a collaboration or a like um a cohort of some kind. And then you like open up applications and then all of your let's call them usual suspects are there. Like that's not the usual suspects' fault and that's not the folks who are missing's fault. It's like, well, did you like make it clear how the funding could be used and like how the cohort would involve people and like how things might be different than they have in the past when people didn't come, and like did you actually offer something that people wanted with this cohort, or did you think like, oh, okay, this we want this cohort, let's make it. So when we listen to story and we use story as strategy and like our key informant and like how we make our strategy happen, that's when like we have buy-in immediately, we have trust built immediately because it's like, oh, these people are listening to me and creating something as a direct result of what I said, and this will impact my life in so many ways. I'm coming, I'm on board, I'm bought in. Rather than like if you get an announcement like this thing has been made and it's for you, it's like, that's not for me. Like if it were for me, I would know about it. If it were for me, like it would be relevant to my life. Like, don't tell me this is for me. I'll tell you when something is for me. And we get so like paternalistic and weird, and we're like, okay, this is for you. And it's like, well, no, actually, I'll let you know when something is for me. Um, and So in this way, when we listen to complexity, storytelling becomes diagnostic. It's not just for communications, though, like I'll go on and on and on and on and on and on about how like really good storytelling create evergreen tools that can be used for advocacy and like um, securing grant funds and donor funding and things like that. Um, and so while it's not just for communications, it makes like great stories make incredible communications, but only when we like allow people to actually tell their stories and again don't try to hold so tightly. And and so storytelling diagnosis then like our gaps in trust and become a really key part of community relationships and internal dynamics and structural equity. Um, And, sometimes I hear people say like, oh, this is like it takes a long time, like it's slow work. And it's like nothing is slower than not doing this. Like you will literally never get where you're trying to go if you don't do this. Um, Whereas if you do this, it might take a little bit of time to get off the ground, but you actually get there and you all go together. Um, yeah. And so this leads me to the next segment, which is like once we've listened to complexity, we can start to design from reality and not from assumption. So often when we don't listen to communities, actually always when we don't listen to communities, we start solving for the wrong problems. So, and like that's why most organizations are using the wrong tools for the right goals. Like they have really good intentions and they really want to, further the health or the justice initiatives that they are signed on to. And um, they're using the wrong tools by like using, hiring a consultant researcher to like do some research about like the most pressing issue they should be focused on rather than like going to the experts in their community, the experts being any community member and being like, hey, what do we need here to heal together, to be together, to address XYZ together. And um in this way, narrative analysis helps team like really realign their strategy and programming. And so there's, like step one is having really meaningful story engagements, which we'll talk a lot about in our time together on this podcast. But and like how to do that is something that I think about and do with partners all day, every day. And I'm happy to connect if that's something that you want to do. And so that first part is really important in how you gather the stories and where and with whom. Um, and then once you do that, it's like also how do you narratively analyze this and how do you analyze this in a way that helps teams really align strategy and programming and learn from those stories. So it's like the beauty is like one storytelling initiative can have like evergreen materials for years to come for your advocacy and comms and fundraising folks. And then also those same stories can like help you create a strategic plan that and inform your strategic plan that will actually get where you want to go because you're bringing the community with you because they are the like key informants, your community and your staff. And so, like one example of this is I worked with an organization that was a statewide organization, and they had, again, all these like really beautiful but very siloed goals for like statewide health improvements. And then I held some story circles and some storytelling events. And then, like, when I analyzed those and got back to them, it was, like we could still get to the goals they wanted to get to, but now we knew how to get there. And their strategy completely shifted based on that and trickled down to the entire state only after they decided to listen differently. And again, it's like they got to get to their goals. They just needed a different strategy to get there. And that strategy had to be based on the people who they're hoping to bring along with them, which again, and you'll hear me say this a lot, sounds like the most obvious thing in the world. And we skip it all of the time. And, so I think in that way, like story is really a tool for precision. Story is a tool for efficiency. Is telling is a tool for moving fast. Because when we allow it to be that and when it becomes our strategy, We are moving with trust. We are moving with buy-in. We are moving with wisdom. We're moving with answers we could never have gotten from research or intentions or assumptions. And so it just is the most like it's really the only way to do it, if I'm being honest. It's it. Um, and so I think the next sort of part of this framework is, movement. So like moving systems forward. And so, the reality is if it doesn't move someone, it doesn't move anything. And so often, well done storytelling initiatives, stories, anecdotes can change the course and do change the course of funding or policy. I say this all the time, like we are designed for this, like literally in our DNA is storytelling. Like we used to like sit by the fire, tell stories. We still sit by the fire and tell stories. We go to dinner, we tell stories, all these beautiful things. And so like um that is going to be the only thing that really changes funding and policy because so often we get so tripped up on these like different like um I don't know, like we get really caught up in deciding that one thing can change one way. And instead, it's like through storytelling, we learn that like the many possibilities for change forward. And that type of change like allows um what a report, we get so hung up on like reports that are really beautiful and well designed and we spend so much time and effort on them, but the people who we are working with to like change policy and move the arc towards justice are not people who have time to read these beautiful reports, and they are people who have time to like listen to a story or read excerpts from a story. And like that's what's going to stick with them far more than the other work that we like pour over that really doesn't result in what we need or want it to. Um, and one additional part in like the terms of like who we move in this is that like a huge added benefit and a key factor in all of this is that ethical grounded storytelling reconnects our staff to their purpose and like reconnects them to the job and builds trust with them. And in a time when like we need every public health, every justice, every values grounded worker to feel connected to their work and also appreciated by their work, this type of storytelling, again, when it is like ethical and grounded, and again, reach out, we can organize that together. Like that will bring staff back home to why they're in this role, why they've devoted themselves to this, and how it still feels possible to make that, make this work feel like the reason they got into it. And so in that way, there's like a huge difference between feel-good storytelling and strategic storytelling. Feel-good storytelling, we see it we see it everywhere. And strategic storytelling is much more of that trust building, like advocacy moving, policy changing storytelling that brings the community along. And um, and so like what makes this different? So you know, the Center for Story and Strategy is led by me. I am Shoshone and Hoopa. I have two indigenous lineages, and storytelling is, like when I grew up, like there was no yes or no answer. It's always, an answer with a story and an answer with a lesson. And and so, like, it's always been the clearest thing to me. And I think more and more it's becoming clear to folks. But unfortunately, like, when the words like storytelling become buzzwords, we see them done in a lot of ways and we see them treated in different ways. And it's like, no, we're not trying to do like storytelling that gets us nowhere. We're doing storytelling that gets us everywhere. And that's just like so possible and so necessary, but it takes like a solid foundation and it takes, carefully. creative programming, which is, what we do at the center. And um, this framework, which I call Entangled Health, because it like just it reminds us that like health is not in silos, and like our mental health is our physical health, is our emotional health, is our social health, is our communal and collective and environmental health. And so it's all entangled in like a beautiful way. And then so like that entangled word like has that positive association of we're all like it's all just one big thing, and we can't try to separate it out or like neatly put it in piles or silos. And also recognizes on the other side of that, like that then our health is entangled with like really big systems that are challenging to navigate. And so it's like it's many, many meanings there. And like this movement really rejects one-dimensional storytelling and embraces that complexity. Um, we really like no good story was ever told or recorded by like handing someone talking points and being like, okay, tell your story. Like that's just not, it's so much richer than that. It's so much more of a process than that. And it's so much more beautiful and wise than that. And like when we try to hold storytelling so tightly, we like strangle its magic and we strangle its possibility and we strangle the potential for like what can be built when we truly listen to stories. Um, and so that's an overview of like our methodology and more so like ideology of like how think about um just like how first we have to listen to the complexity and like honor complexity and honestly be grateful for complexity. And then from there we can design from a reality and not assumption when we like let story be strategy. And when we do that, we change systems, we move systems by using storytelling strategically, creating strategy based on story, advocating with like powerful story. Sort of like once we do that, we just move in all these directions with like deep, grounded storytelling that like has the trust of the community and also reconnects staff to their purposes. And so I wanted to just like send you off into the world with a little bit of let's call it a thought experiment. And so I think like an important thing is if you choose a project or a program that you're currently working on, I'd love for you to ask yourself whose voice shaped it, what trust gaps are showing up, and what story is being told, and what story is missing. So those are four questions. Whose voice shaped it? Whose voices shaped it? What trust gaps are showing up? What story is being told? And what story is missing? And these are the types of questions that I work with clients on when we go through our Story Lab sessions. And Story Lab sessions are um, a 3-hour strategy meeting where we look at like the potential within your organization for storytelling and where it could be and where it could like seamlessly fit in. Because I know that like, to make storytelling work, it's like we don't need to build a whole new department or a whole new team. We just need to like look at where things are and create a strategy from there based on the wisdom of your staff. And then from there we can plan out, like how to implement it. So um would love for you to reach out and work together on that. I would love to get into the weeds with you on what could be possible and like what storytelling could also make possible in your organization. And with that, I'm going to send you off into your week. Thank you for joining me. And if this framework brought up any questions, I welcome you to take it back to your team and start asking different questions because great questions are where the shift begins. And you can find more out at www.madisonmurphybarney.com-entangled health. Um, and you can follow the Entangled Health podcast wherever you get your podcasts. And until next time, stay curious, stay connected, and keep weaving.